I'm so glad we're talking about this topic, and you both highlight this, and hopefully everyone's listening to your stories because it's important, because there's also some management decisions that need to be made, and I know, Halsey, in your case, Dr. Aliabadi, and you are really put a plan together. Can you talk about that?
Yeah, of course. We started with an IUD, and it made things a lot better. And then I had an endometriosis ablation and the laparoscopic surgery about a year ago. 2 weeks later, I walked the Grammys red carpet with stitches, and I applaud you for being here because I know it's tough. And you know, I'm 23 years old, and I'm going to freeze my eggs. And when I tell people that, they're like, why would you do that? You're 23. Why do you need to freeze your eggs? And doing an ovarian reserve is important for me because, you know, I'm fortunate enough to have that as an option. But I need to be aggressive about protecting my fertility, about protecting myself. And reproductive illness is so frustrating because it can really make you feel like less of a woman. There's a lot of times when you're sitting at home and you just feel so terrible about yourself. You know, you're sick, you don't feel sexy, you don't feel proud, you don't feel like there's much hope. And so taking these measures to make sure that I get to have hopefully a bright future and achieve the things that I want to achieve by doing that ovarian reserve is really important. And that's the other thing too, is getting it young. And that's why we need to make sure that women know that being in pain when you're menstruating is not normal. It's not okay. We can't minimize these people's pain and tell young women, oh, get over it, you're being sensitive, it's your period, because there could be an underlying issue that could kill them. That's very serious, and it's not okay.
If anyone is at home and you're experiencing a significant amount of pain, I would encourage you to seek out another physician, talk to somebody else, because you should not be living like that.
And let me tell you, on average, it takes about 7.5 to 11 years to diagnose a patient with endometriosis, average being 7.5. Yeah. The average age of presentation and diagnosis is usually age 32. And the reason so many patients get undiagnosed or they get misdiagnosed is because a lot of the symptoms of endometriosis basically overlaps with other common conditions like PID, recurrent bladder infection, constipation, irritable bowel syndrome. So these patients get labeled with different diagnoses, yet their pain is never addressed. The other issue is we really don't have any tests, you know, to diagnose it with. I can't do a blood test or do an ultrasound. Well, I can diagnose severe stages on ultrasound, but usually it's tough to diagnose it just by seeing the patient. So for me, I have 3 red flags in my office. Let's say for your annual exam, you sit on my chair and without me asking, you bring up painful periods, that's the first red flag. Okay. I've been to a gynecologist, I've never brought up pain. Do you know, I'm here for my pap smear and that's it, right? Yeah. As soon as someone says, and doctor, you know what, my periods are very painful, boom, first red flag. Second is if you stay home from school or from work, because you're in pain, if you can't go on stage, if you can't go to work, right? You were telling me sometimes it's very difficult for you to go on these shows.
I've worked with food poisoning, and it was easier than working. You can't even tell that I was sick because it was easier than working with my period, on my period.
So that's my second red flag. And the third one, which is almost a stamp of diagnosis, if you end up in the emergency room with pain during your period, it's a red flag. I
think this segment has maybe been one of the most educational we've ever had on our show in 10 years. And certainly, we'll have more resources on our website. The reminder, 1 in 10 women suffer from this here in the U.S. I want to thank Kate and Halsey so much for opening up about this. Dr. Aliabadi, thank you, as always.